Dr. Neelam Maheshwari doesn't require any introduction, but she's graduated from our own SMS in 1988 entrance batch. She's an associate fellow of Maulana Azad Medical College, New Delhi. She did a master in immediate implantology in 2017 from Germany. She's a teacher of IF. She's a diplomat of WCOI, and she's certified AID implantologist as well. And she is an lady who's running her practice from 1995, managing the family and having a very exuberant practice at Maheshwari Dental Clinic, which is evolved to become one of the finest dental clinic in Rajasthan, and it started as one of the first clinic in Rajasthan to start with the basal implantology. Here to
Thank you for kind words, Dr. Whenever there comes the name of Pink City, the pick of Hawa Mahal comes to us. I want to tell about one of the 7 amazing fact that this is the longest building in the world without foundation. Our Pink City is awarded as UNESCO's Heritage City 2019. And I will thank to my mentor Dr. 𝑰𝒎𝒑𝒏𝒕 and my mentor's mentor Dr. 𝘸𝘪 sir, who has taught us basics of implantology. And when patient come to us for fixed teeth option, we used to see the OPG and study models, and we just take the bite of it, and patient ask about the cost of the treatment and time of the treatment. Then when we evaluate the x-rays and we see the study models, we used to do bone sounding. Then when we see pneumatized sinus are there or resolved diseases are there, so time is the constraint, and if we have to perform the case without sinus lift or without bone augmentation, so 𝐸𝑠ℎ Dental has designed our implant system in such a nice way that we used to avail the patient's own bone that is there. They have different implant designs available so that we can use patient's asset rather than creating bone to accommodate the implants that are available in the market. So my topic of presentation is importance of implant design in immediate function loading. I'm not here comparing the conventional versus basal implantology, but my purpose is this, that how basal implantology is different in the way we are doing rather than going with the alveolar implantology. If we are considering the bone, we are always using the hard bone that is not affected by the any infection or any trauma from occlusion. We are engaging the hardest part of bone that is highly mineralized and less affected by other factors like trauma from occlusion or peri-implantitis, etc. So as previous presenters have told about what bone we have engaged, I will not go detail of it, but all green zones are highly mineralized and they are expected for very good integration and very stable implants. We used to engage the cortical bone because after extraction the alveolar bone is supposed to resorb with any type of infection or trauma or anything. As soon as we extract the teeth out, alveolar bone will go. That is supposed to go. So our purpose is to engage the cortical bone, whether it is mandible or whether it is maxilla. Regarding technique, we are following the orthopedic concept that is derived from traumatology. So in the same way, we are engaging all the basal bone. Our purpose is to avail the maximum highly mineralized bone and make it everything well stable, well organized,